myself, Dr. Preeti Kadu. I am founder and chief dentist of the Dr. Kadu's Orthodontic and Dental Clinic. Today I am going to discuss about the dental implants. What is a dental implant? In which cases we should go for the dental implants, and all concern about the dental implants, whether it is painful or not, how is the procedure of the dental implant, why the dental implant is costly, and what is the life of the dental implants. All these things we are going to discuss in our today's session. What is dental implant? Dental implant is a metal screw-like post which we placed inside our jawbone. In some of the cases when there is a single missing tooth, for example the front tooth is missing, or in some cases the back tooth is missing, whether it would be one tooth or the multiple tooth. In all such cases, dental implant is a very good option. In old age patient, when they have all the missing teeth and they want to put the set of dentures, in such cases also a dental implant is a very good alternative. Placing implant in a jawbone is considered as a minor surgery in which the local anesthesia is given. Implant is placed inside the bone and we have to wait for around 2 months, 3 months or 4 months in some cases so that the implant gets fixed inside the bone. That process of implant get fixed inside the bone is called an osseointegration, in which the bone form around the implant and it make the implant very sturdy so that whatever the artificial tooth we are putting on top of that will be more sturdy, and you will be able to chew with the implant just as good as your natural teeth. We have seen in our practice that many patients are scared about the dental implants. They feel it is a painful procedure. So let's explain this. See, putting a dental implant is a simple procedure. When you get your teeth extracted, at the time we have to give you anesthesia. So in the dental implants also we have to give you local anesthesia in which your entire jaw will become numb. So putting the implant is not at all painful procedure. What you can feel is just a simple pressure while putting the implant. That's it. It will not be painful anymore. During procedure, all the disinfection and the sterilization protocols are followed, which reduces all the chances of the infection around the implant. So it is very comfortable procedure for the patient. Before the implant procedure as well as after the implant procedure, some medication has to be taken by the patients to make the procedure more comfortable and painless. Many patients have their concern about the cost of implant. They feel the implant is very costly. So let's see about this aspect as well. Dental implant, as I said, it is made up of a titanium alloy. Titanium alloy has capacity to get osseointegrate, to get fixed with the bone. So that material, the implants are very expensive. Secondly, the skill of the dentist, the skill of the implantologist who is placing the implant is also very important. More skillful the implantologist is, more comfortable patient will be and the more will be the life of the implant. An artificial tooth is placed on top of the implant, which is also expensive. So that's why the skill of the doctors, the dental materials which is required during all the implantation procedure, as well as the crown which is placed, sterilization, disinfection, all these procedures can cost you a lot.
Cost of implant may vary from around 20,000 to 30,000, 35,000 or maybe more than that. It's depend on type of the implant your implantologist is choosing for you.
Also, during some of the cases, we require 2 surgeries, 3 surgeries during the implant. Again, in some of the cases, bone grafting means putting an artificial bone around the implant is also required. So all these things can add to the cost of the implant. But now when you compare it with the bridges or the crowns, the life of the implant will be much more. So whatever you are investing right now in the dental implant, which will be for the long term, you will get a tooth which is more likely to be act as a natural tooth. So in the long run, the chances of the cavities in the implant tooth will not be there as compared to the bridge. Also, the chances of the gum infection around the implant will be lesser than that compared to the bridge. So looking at all these factors, the single tooth implant is the best option in any case. Provided a good amount of a bone is present to place the dental implant, as well as the oral hygiene of the patient is good to have an implant, and the soft tissue around it, the gums and all around it are in a good condition. What is the life of an implant? Dental implants, once get fixed into the bone, can survive for a very longer period, maybe around 15 years, 20 years, or sometime maybe more than that. But the life of the implant also depends on the oral hygiene of the patient. As we require proper cleanliness and good oral hygiene maintenance for our natural tooth, the same thing will be required for the dental implants as well. If there is any gum infection around the implants, sometimes the thread of the implants get open, so the life of the implant can reduce. Another common question from a patient is how much duration is required for the implant. So first of all, we need to evaluate all the medical history of the patient. In general, whenever we are placing the implant, after placement of the implant, we have to give some waiting period for the osseointegration, in which it may require around 3 to 4 months depending on the patient. Once the implant gets fixed inside the bone, then we have to take the measurement to put the artificial crown on top of the implant. So approximately it could take few months, maybe around 4 to 5 months for the complete implant procedure, from the time we have placed the implant till the time we are putting an artificial tooth in your mouth.
You can subscribe our channel for more informative videos. Thank you.